One of the great things about living in America is that generic drugs are available at every pharmacy. They provide a really cost-effective way for us to get our medication. And I've never seen a study that suggests that generic drugs are less safe than brand name drugs. They're a godsend.
A lot of patients, and unfortunately a lot of doctors, somehow think that generics are not as good as the patented product on which they're based. And that really is not the case. A generic drug is simply the identical chemical that you might have previously had to buy as a brand name product.
So the difference is now that the drug might look a little different, the color might be different, the shape might be different, but it has the same amount of active ingredient inside the pill. I recommend generics over brand name because there's a significant cost savings.
I probably take 4 or 5 different prescription medications. Every medication I take is generic. I have never seen a difference in quality between a generic and a brand name, whether it's Tylenol or whether it's some of these other medications that I've had to experiment with over time. I've never had an issue with a generic drug.
Over the years, I have prescribed hundreds, if not thousands, of generic drugs and have never once seen a problem resulting from it.
Well, I have heart problems. I have high cholesterol and I have diabetes. I take 10 drugs a day for my conditions. Most of them are generic. I was leery of them when I first heard about it, but like I said, I've been on quite a few years now. I've been feeling good. I take them every day and there's been no problem.
Generics are safer in that they have been around a while, and so we've gotten to learn how to use them. If there are problems about them, we've found out about them, which is not always the case for a brand new drug where you may have a rude surprise because it hasn't been taken by enough people to understand its safety. But just because something's new does not mean that it's better.
There are serious costs to prescription drug medications. And even if you have insurance, if you don't have generic drugs, they become totally unaffordable.
For people who don't have insurance and they switch all the medications to the generic equivalent, they can save up to half the cost that they would pay throughout the year.
In the morning, I take approximately 13. During the day, I take anywhere from 2 to 6. Depending upon where my pain threshold is. And at night, I take 9. If I was on all brand medication versus generic, I would have a lot of trouble paying for my medication, not counting paying for food, insurance, maybe going to a movie once a month, or that money just wouldn't be there for me.
And for a lot of people, it's also the difference between can they afford their drugs and can't they? And that's a very big problem.
I am on a budget, and I'm so glad for those generic medicines. And I really do believe that the generic medicines are keeping me alive. And I couldn't afford them no other way.
It's hard to watch TV and not see the drug ads.
Well, if you're a drug company and you make a pill for high blood pressure, and you can either have a patient taking a pill that'll cost them $1,000 or $1,500 a year, or something that'll cost $50 a year, obviously there's a lot more money to be made by getting that patient started on a drug that's going to cost over $1,000 a year. So a tremendous amount of money goes into promotion, marketing, advertising to get doctors and patients to want those expensive drugs.
There's all expensive ads on television and even some in magazines. And who's funding those? I believe the drug companies are funding those.
The drug companies spend about $30 billion a year on all forms of advertising to doctors and to patients. I'm worried that an awful lot of what we doctors know about drugs comes to us through either sales reps or ads in medical journals, or our patients coming in waving an ad saying, I saw this in the magazine and I want you to give this drug to me.
Most of the drug ads I see in magazines, or even a few on TV, are all brand names. Yeah. I don't think any of them are generic.
You got to talk to your doctor when the doctor writes a new prescription saying a lot of things that patients need to press us about more than they do. One is, what is this for? Why do I need to take it? How should I take it? But in addition to that, is there a generic version of this available that will work just as well? I think they need to ask doctors, is this medicine available as a generic? Or is there a medicine very much like it that's available as a generic that might be a little bit different, but effectively the exact same drug?
One of the downsides of the medications that I take for my arthritis is that they can cause ulcers. And a few weeks ago, I was actually getting the feeling that I was developing an ulcer in my stomach. One of the things that I did was to call my doctor and ask if there was any alternative to the Prilosec that I was taking. And he said, well, there is another alternative, but it's not generic. It's a brand name medication and it's very expensive. I don't think your insurance company will cover it. But what I did when I picked up that prescription was I went to the pharmacist and I said, there's this medication called Protonix. Do you know when it might become generic? And she said, it became generic last week.
Pharmacists can be really knowledgeable allies in this. They tend to know what things cost, which we doctors often are oblivious to.
I trust my pharmacist.
Please come down, see us if you have any questions whatsoever about your medication, whether it's questions about side effects or generic medications. That's what we're here for.
A lot of patients, especially older patients, are timid about raising these questions. And they shouldn't be, because we are there to serve patients, and part of our job ought to be to answer tough questions.
Try not to be too timid, because I was a little bit nervous about saying anything to my physician who did not want me on the generic Effexor. And then I said I need to because of cost. So I think they need to speak to their physician about it, bring in reasons that they feel it would be better for them.
You do have to talk to your doctor about the generics.
When a doctor prescribes a medication to you, ask if it's available in a generic.
Go to the pharmacy, talk to the pharmacist about generic versus brand.
And find out the prices and how good the prices are.
The cost of medications these days is so expensive. And generic drugs is a way to save costs for something that's really necessary for life.